Today we will learn about sarcoidosis management. Sarcoidosis management. Let's start the sarcoidosis management. Very much important disease in respect to the respiratory system. So at first we'll give a general management. Okay, in general management we will teach educate patient avoiding direct sunlight. Okay, otherwise it may causes increased secretion of hyper or calcium. It aggravates the disease. Then pharmacological management. In pharmacological management, the drugs. At first we'll go for NSAID, where you will use if the patient has come to you with acute illness and there is erythema nodosum. Okay. Secondly, we may use with that a short course of steroid. So steroid or specific glucocorticoid. Now how you can use it? You can go with short course for initial presentation. Okay, or you can give topical in case of mild uveitis. Okay, and then you can go for inhalation for asymptomatic pulmonary effect. Okay, parenchymal involvement. But if you have to give systemic steroid or glucocorticoid for long term in some condition, like if there is hypercalcemia, it means the renal involvement, pulmonary involvement, or eye involvement, uveitis. Okay, you must give steroid in such condition long term. Third, there are some immune modulatory drug. You can give methotrexate as a theoprine or tumor necrosis factor alpha. These immune modulatory drugs in severe diseases, if there is more than 3 organ involvement or severe diseases. Okay, in case of only cutaneous, or you can with the drug you can give chloroquine hydroxychloroquine or thalidomide in cutaneous. It is called cutaneous sarcoidosis. Severe disease, another, it is known as the lupus pernio. In case of methotrexate, you can also give 3 organ lupus pernio, and for cutaneous, chloroquine. In some patient in last stage, we can also plan for transplant single lung. if possible. It is the last resort. Okay, so these are the main treatment procedure. We'll look for sarcoidosis. So again, generally we'll educate the patient to avoid the sunlight. In pharmacological management, acute illness, NSAID, you can give a shortcut steroid with NSAID, but topical one for mild uveitis, inhalation, asymptomatic, pulmonary parenchymal involvement. In systemic steroid, like I can say prednisolone, okay, you can give it for longer period if there is hypercalcemia, renal involvement, pulmonary uveitis. Immune modulatory drug, methotrexate, azathioprine, tumor effector alpha, if more than 3 organ involvement, lupus sparnium. Chloroquine, hydroxychloroquine, low dose thalidomide in case of cutaneous sarcoidosis. Lung transplant is also possible. Okay, thank you very much.